Dr. Babu, your take first. Do you think the move towards booster shots is in a sense actually fueling the inequity, because makers who are able to produce large quantities of vaccine are focusing them on countries that can afford to give their citizens a third or fourth shot?
Yeah, thanks, Tamanna, for having me on the show. I agree with you. So currently what's happening is the CEOs or the people who are on the top management of these pharma firms or the vaccine firms, they are calling for booster shots. This is very unfortunate in this world that instead of providing the evidence and then the World Health Organization or other governments accepting in terms of the need of booster shots, the firms themselves are calling for the booster shots. And this has been definitely feeding into the fears of many people, especially those who are healthy aware, health conscious. They would want to get an additional dose, and there have been queues in several hospitals in the West where people want a booster shot. But we need to understand two aspects here. One, do we have a coherent assessment of breakthrough infections in those who are already vaccinated? And what is the risk of hospitalization or death? And therefore, what is the requirement of booster shot? So that's part A of the first point. The part B is the infection itself is supposed to give other aspects of immunity. Now, there is frontline soldiers, which are neutralizing antibodies, and there is T cell response. So once somebody gets breakthrough infections after 2 doses of any vaccine, what is the additional advantage in terms of immune response people are getting? That we don't know. So these are scientific. The next aspect is on equity, as you rightly said. When the most of the world, especially in the low and middle income countries, do not have access to even 1 dose of vaccine, there are more than 40, 50 countries where even 5% of the population is not vaccinated. So there are some where even 1% is not vaccinated. Is it right to go for a booster shot when we really don't know whether it's going to help or not? So this is going to create greater inequities and worsen the access to the vaccines all over the world. So this is a new challenge, and it's not just the World Health Organization, even the developing countries together will have to have a collaboration. It's not the West versus the East or the developed versus the developing. We need global collaboration to stop this. Otherwise, there will be more chaos in the future.
Yeah, but is there an incentive to stop this? Is the question. Dr. Arvinder Soin, let me first ask you a different question, which will be relevant to our viewers. Are there certain categories of people who will require a booster shot to be safe, and it medically makes sense for them to have a booster shot?
Yes, sure, Tamanna. Transplant patients, elderly patients, patients with comorbidities, patients with immune suppressive medicine, all these may not develop enough antibody response and immunity with just 2 doses. So there are a subset of patients and population that would possibly benefit with the third dose. However, that's not just the science of it, there is more to it. And that is that if you consider that the pandemic will not really go away until 60 or 70% of the world's population is vaccinated, then it is very short-sighted of the vaccine-rich countries and even the pharmas, or for that matter, the vaccine-rich country governments to play up to the pharma to allow third shots. If they've had 2 shots, definitely the vaccines, excess vaccines should be donated to countries where they haven't vaccinated enough people. So those with no vaccination should have 1 shot, and those with 1 should have 2 shots, and only then third shots should be considered if you look at it in a global fashion. But you see, life's not that simple. Now, for example, US has had just barely 50% of its population vaccinated, although they have enough vaccines. So if they're not going to actually vaccinate people who are not, the anti-vaxxers, they may as well donate them. On the other hand, if there is no clear path for donating these vaccines to vaccine-poor countries, then they may as well start with their third shots. What are the vaccines doing? They're just lying around. So, it's all very complicated. But overall, if there is one thing that needs equitable distribution in the world at this point, it is vaccination, for sure.